In this video clip, we're going to take a look at a common occurrence in both hospitals, home care, and nursing homes. When a patient falls, we all want quickly to have that patient off the floor. And many times we make a poor decision by manually lifting. We noticed often that when a patient falls, there's numerous people available on scene. And it's very important to take charge and have a leader start to point out how we're going to move this patient off the floor. Getting the right sling, getting the lift, there's enough people to help get ready for the transfer. In acute care or any setting where a patient may be having a cardiac arrest, the best place to start that intervention would be on the floor. And so again, we never problem solve by manually lifting that patient off the floor. We use that sling applicator tool, those two pieces of plastic, to slide that sling from the head of the patient down to their toes. Sliding the sling under them helps us prevent the need to have to turn and roll that patient. Working as a team, we're ensuring that we're positioning the sling correctly under that patient before we make the transfer happen. We're going to use a limb strap here and show you how you can lift the lowers, which could be very heavy, by connecting them to the carry bar, running the limb strap under both legs. The mechanical lift will lift the legs and allow us to position the lift in the right position, which is very close to the patient. We're going to put a pillow on the base of the lift for the comfort of the patient. We're going to be sure that we position the legs on the side of the lift where the actuator is not. Remove the limb strap. The lift is in the right position, and we're going to start to attach our straps. Mechanically lifting a patient off the floor can be done with 2 people, and if 4 or 5 people show up, it can be done with that many people. The thing to remember is you're not going to do it manually. You're going to use all your safe patient handling tools and strategies to get the patient off the floor safely and without manual exertion. In this clip, we're going to take a look at a transfer out of bed using a ceiling lift. The patient is on a split leg hammock sling. The ceiling lift is brought in and the patient is attached. Some of the most important things to remember when you're doing a transfer out of bed is that you want to use the bed to your advantage. You don't want to lift the patient to the carry bar. You want the patient to be close to the carry bar by elevating the head of the bed. Attaching your loops equally and evenly and checking that you have a solid attachment is one of the most important things before you move a patient. So when we attach the loops of the straps to the carry bar, we want to ensure that it's solid and secure. So we never move the patient until we've tested them in that sling unweighted over a safe surface. So once we lift the patient up and their full weight is in the sling and none of their weight is on the bed, only then we can tell if the straps are on correctly. With the assurance that the patient is safe, only then do we move the patient away from the bed. Same thing if the patient was in a chair. They'd be lifted over their chair and not moved until we were sure they were attached correctly. Never move a patient without 2 assists. You're guaranteeing that you're monitoring the patient's position and comfort and safety while somebody is controlling the machine. A gentle push at the knees guides the patient's hips back into the chair. There is no reason to hang on to the handles of the back of a sling and pull a patient into position. Portable ceiling lift motors are easy to attach and use. Most important thing to remember is that when you're using a portable ceiling lift, you don't want to lift the motor. It's wheeled into the room on a cart. It is attached to a reacher bar. That reacher bar takes your strap from your portable motor and attaches it to the trolley up in the track. This healthcare worker is attaching the motor without any lifting or any exertion. By putting a little slack on the strap in the lowering position, it'll allow you to reach that trolley. With a push of a button, the motor is lifted off the cart, pushed over to the patient's bed, and it's ready to use. What we're going to take a look at in this video is the use of what we call air assistive devices. This type of a device is put on the bed and it can stay on the bed for the duration of the patient's need. It is loud, it's connected to a vacuum. The patient is strapped into it just for security. Once the vacuum is turned on, it starts to inflate the mattress. This air mat type of device is not used until it's fully inflated. The air is being forced out the bottom of it, which creates an airflow pocket that removes resistance and strain. So you could see how a patient could be safely transferred from one surface to another. We always ensure that the brakes are on. We bridge the gap with a slide board. We have the bed higher than the bath cart the patient is going to or gurney. We move the feet first, leaving the head over a safe surface. Working as a team, you slowly transfer the patient out of the bed.